Brady and Ranya. Brady is from Sacred Heart, and Ranya is a junior in Homestead.
Hi everyone, I'm Ranya.
I'm Brady.
And today we will be presenting our research project, which is on the impact of the COVID-19 pandemic on pediatric dental health. So, the pandemic had a large impact on all of us in many different ways. Due to the lockdown and certain restrictions, a lot of us were stuck at home for an unusually extended period of time. And this led to a change in behaviors for a lot of us. For example, for me, during online learning, I remember I would consistently stay in bed the whole day with my laptop propped in front of me and a huge bag of Haribo gummy bears readily at my side all the time. And I'm sure a lot of you can relate. Our absence of social interactions and just going outside in general probably also led some of us to care less for our dental hygiene. And so Brady and I thought this change in behavior among us and our peers to be very intriguing. And so we decided to use data science to quantify our observations. Now, some of you might be thinking, isn't it kind of obvious that COVID-19 would have a negative effect on pediatric dental health? Well, yeah, sure, but it's always very important to quantify your observations because that's how you solidify them and provide a clear evidence-based understanding of your problem as well as its magnitude. And it would also be just as interesting if we found no change after COVID. So our main question we wanted to answer was how did the pandemic impact three different metrics: patient visits, patient procedures, and procedure fees. You can also think of them as dependent variables. So we would compare these metrics before and after COVID to see if they increased over time, remained the same, or decreased over time, and if so, by how much. And we also wanted to look at this across different demographics, so age groups and racial groups. And we achieved this by contacting a local pediatric dental clinic, and they provided us with a data set of size over 3,000 patients. And we took data from two different time periods, 2 years before COVID and 4 years after, with a 3-month lockdown period in between where the dental clinic had to close down due to state regulations. And by doing this, we could compare our three metrics before COVID and after COVID, following the same patients.
One of our initial questions with the research project was to see how the COVID pandemic disproportionately affected certain groups. And the first group that we looked at were different age groups. And so when we initially looked at the aggregate view of the data, we couldn't find any straightforward results that showed that certain age groups were affected differently by the pandemic. However, when we assigned a binary value to each patient, which decided whether or not they had more procedures, more procedure fees, and more visits after the pandemic than before, we were able to find some interesting results. And so when we looked at the age, we decided to divide the patient ages into three separate groups, which were three separate bars. The left side is preschoolers, the middle is elementary schoolers, and the right side is teenagers. And the reason why we did this is because we believe that these certain groups would have the biggest changes in their habits regarding dental hygiene. And the dark blue part of the bar is the percent of patients that had more visits after the pandemic, and the light blue bar is the percent that did not. And so when we compared the change in visits across the three age groups, we found that a higher percent of the younger age groups had more visits after the pandemic. And this was interesting because the majority of teenagers actually experienced less dental visits after the pandemic than before. And one reason we believe this could be is because parents have less control over their kids as they get older, or over their kids' dental hygiene and dental care when they get older. So they wouldn't be able to have them go to the dentist as often. And the results were pretty significant, as it showed us that the effects of COVID were not evenly distributed throughout all patients. And the results also aligned with our hypothesis about age going into the experiment, as we believe that patients who are older would be more diligent about their dental hygiene, whereas younger kids would be more likely to snack during the day and not have as strong habits about brushing their teeth. And so we also wanted to look at how the pandemic had any disproportionate effects on dental care based on race. And so we were able to use patients' zip codes and combine it with the 2020 census database to find out what percentage of a population was a certain race. And also, since there wasn't a large sample of African American and Hispanic patients alone, we combined the two, and we used the census database to identify if the patients were from a zip code that had a high Black and Hispanic population or not. Each graph depicts a separate age group. The left is preschoolers, the middle is elementary, and the right is teenagers. So overall, the patients from a zip code with a high African American and Black population experienced a higher percent of increase in visits as opposed to the patients that were from populations that had a lower African American and Hispanic population. And these findings were pretty significant, as it showed us that the pandemic had a bigger effect on the zip codes that had a higher Black and Hispanic population as opposed to those that did not. And we believe that a part of this disparity could be due to the fact that underserved communities don't have the same access to dental care education that other communities do. And we also were interested in finding insights about how certain patients' behaviors affected the amount of procedures that they had. And so we initially hypothesized that the longer patients waited to see the dentist, the more likely they would have cavities and other dental issues. So we measured the delay in days for patients to see the dentist after the pandemic, and we grouped patients based on whether or not they waited longer to see the dentist than the median delay before seeing the dentist. So the left bar of the graph is a group of patients that waited longer to see the dentist, while the right bar of the graph is patients whose delay was shorter. And looking at the graph, you can see that the patients who waited longer, or a higher percent of the patients who waited longer, had more procedures compared to the patients that did not wait longer. And the reason that this is very interesting is that it means that the longer patients waited to see the dentist after the pandemic, the more likely it was that they had dental hygiene issues. And this aligned with our initial hypothesis. And another interesting insight is that overall, 57.3% of patients had more expensive fees per year after the pandemic than before. And while part of this can be attributed to increased fees due to inflation, patients also experienced more procedures or more visits. So nearly 60% of patients experienced an increase in visits, and combined with the results from the previous slide, these two tell us that overall the pandemic had a negative effect on patients' dental care in both their fees and number of visits. But what this also means is that the specific dental clinic, or the business for the specific dental clinic, did better after COVID than before.
So in summary, we found that the pandemic disproportionately affected different demographic groups. Younger people were more negatively affected by COVID than older people, and Hispanic and Black patients were more negatively affected than other races. Or to be more accurate, people from zip codes with higher percentage of Hispanic and Black people, on average, were more negatively affected than people who lived in zip codes with less percentage of Hispanic and Black people. And so our findings show the importance of public health policies pertaining to pediatric dental health with targeted health care for those that are younger and Hispanic and Black. So the statistics we've shown you today are just among a few that we're currently looking at. For example, right now we're also looking at the long-term versus short-term impact of the pandemic. So we're comparing 4 years after to 2 years after to see what had a lasting impact and what didn't. And we're also looking to get a control group. So the same time length, which is 6 years, except there won't be COVID in the middle, to see what exactly COVID did change and to get rid of any confounding variables. And so our next step is, which we've already started on, we want to consolidate all of our findings into a paper and also bring awareness to the disproportionately affected. And we also plan on doing this by bringing a dental screening to the Alviso summer camp hosted by CP Mentorship in the near future, and also through community outreach to help these underserved communities. Thank you.